I want to welcome you all to the University of Southern California Keck School of Medicine and the National Hispanic Medical Association Academic Partnership Informational Session. We are going to be talking about the Advancing Physician Leaders Fellowship Program and talk about our partnership, what our needs are, how you can help, and what the future is. So we hope to cover all that in less than an hour. Next slide. Next slide, please. So before we get into the discussion, just a few housekeeping items. Microphones, all participant microphones are able to be unmuted throughout the discussion. If you have any opportunity to ask questions by raising your hand or just adding them in the chat, and we will get to that. This session will be recorded and will be available to all the registrants as a link after the end of the session. And before we get started, what we'd like to do is to please introduce everybody on this call. Let us know who you are and share your experience with NHMA and or USC, and then we'll move forward. I'd like to introduce myself first. I'm Diana Torres Burgos. I'm the physician lead for the Leadership Fellowship with NHMA, and I've been with NHMA for over 20 plus years. Jonathan, would you like to go next?
Yes, thank you very much, Diana. Hi, everyone. I'm Jonathan Cohen. I'm a professor of clinical population and public health sciences at the Keck School of Medicine at the University of California, and also director of policy engagement for the USC Institute on Inequalities in Global Health. And I have the pleasure of representing USC in this partnership with NHMA. Maybe we'll go to Linda next.
Thank you. Hi, everyone. It's great to see so many familiar faces. First of all, welcome. I wear multiple hats, as many of you are aware. So I'm an adjunct clinical assistant professor in medical education at the Keck School of Medicine. I am also serving as president of our Keck Alumni Association, and I serve on the USC Board of Governors. And with NHMA, I serve on the board of directors of NHMA, and I currently chair the National Policy and Advocacy Committee, and I'm also a past NHMA fellow. So I look forward to sharing my experience with all of you. Who shall we go to next? Let's see here. Shall I just popcorn it to someone? How about Vito? Thank you.
Thank you, Dr. Murdomai. I did not see that one coming. I'm Vito Garrity. I'm the Director of Strategic Partnerships here at NHMA. I've been with the association for 6 years now. Started out doing project management and overseeing all of the grants with the team, and have recently transitioned into this role. So it's a pleasure to be here. Thank you to all of our speakers and all of you for attending and giving us your time today. We really appreciate it. So I'm looking forward to it. Thank you. I can send it over to Dr. Preciado.
Okay, I'm Dr. Preciado, and I'm an internist in Pasadena, and I'm also on the board of NHMA. And last year I was a co-chair, and we put together a beautiful NHMA conference in Anaheim. And somebody asked me, well, how are you affiliated with USC? Well, Linda knows that I was a resident at Huntington Hospital, and I did most of my rotations, at least a year of them, at USC. So that's how I'm affiliated. How about Patricia Ibarra? Is she on the line?
Hello, everyone. Thank you for all being there. My name is Patricia Ibarra, and as Dr. Preciado mentioned, I train at Huntington Memorial, and that's how I'm affiliated with USC. I actually went to school in Omaha, Nebraska at Creighton, and I trained with Linda Mirdamati, Dr. Mirdamati. So that's how I know NHMA, and I've been going to some of the galas and participating in some of the programs, which I find very helpful. I'm retired internist, so I think this is great that all of you people volunteer and try to help young people, mentor them. Any questions?
If we could just go more a little quickly. Michelle Cabrera, por favor.
Hi, everybody. Thank you for having me. I am an OBGYN in Los Angeles. So I don't have a direct affiliation with USC. I used to be affiliated with Huntington Hospital, but now I'm in South Central LA practicing. I was NHMA, an NHHF fellow 3 years ago, and I've done the policy coaching for the women's health portion of it for the past 2 years. So once again, thanks so much for having me.
And she's the new chair of the LA NHMA chapter, Michelle Cabrera.
Great. Magdalena Arenas.
Good afternoon. Thanks for inviting me. My name is Magdalena Arenas, and I am affiliated with USC as I went there as for medical school, and back again for pulmonary critical care fellowship. And I get to teach introduction in clinical medicine with Linda. And I am currently serving as the Executive Medical Director of Inpatient Services at Huntington Hospital, the affiliate of Cedars-Sinai. Thanks for having me.
Thank you. Edward Mena.
Hi, everyone. Good to see a lot of familiar faces. I graduated USC in 1999, and I did my fellowship somewhere around 2002, 2003. It's been so long, I don't remember. I am a hepatologist here in Pasadena, and I've been affiliated with NHMA for quite some time, and my area of interest is fatty liver in the Latino community.
Great, thank you. Maria Maldonado.
Hi, thanks for the invitation. My name is Maria Maldonado. I graduated from USC's PA program in 2006. I was a National Health Service caller and did my service time at South Central Los Angeles and also North Pasadena at Community Health Alliance of Pasadena. I serve currently as the Assistant Dean at Keck School of Medicine for Community Partnerships and Workforce Development. I teach in the PA program. I'm a clinical assistant professor in family medicine, and I serve as a director of the Center for Gender Equity in Medicine and Science at KSOM, as well as the director of the USC PA Pathways. My interests are in training the next generation of providers that come from under-resourced areas so that we can all address the social determinants of health together.
Great, thank you. And John Rodalte.
Hi, everyone. So I'm a pediatrician in La Cañada and also on staff at Huntington Hospital. Graduated the same class as Dr. Murtamati from USC, and I've been teaching a clinical instructor there for the Introduction to Clinical Medicine course for about 24 years, and was fortunate to attend the last NHMA conference in Orange County and be one of the speakers. Thank you, Dr. Preciado.
Great. Thank you. Taylor Burkholder.
Hello, everybody. I'm Taylor Burkholder. I'm an emergency physician at USC, practicing at LA General Medical Center. I'm also an associate professor in the Department of Emergency Medicine and the director of academic programs for the USC Institute on Inequalities in Global Health, where I've gotten to work with Professor Cohen on issues around health policy and global health, which is how I was connected with this group as well.
Thank you. And John Sanchez.
Good afternoon, John Sanchez, Keck School of Medicine graduate, 1986. I'm a recently retired, semi-retired OBGYN. I am still affiliated with PIH Health in Downey, where I am OB faculty for our family medicine residency program.
Great, thank you. Viviana Garcia.
Hello, everyone. My name is Viviana, and I am the manager of special projects and programs here at NHMA. I work alongside Dr. Torres Burgos, as well as Vito on this project. Thank you all for being here.
Thank you. And Yvonne Malloy.
Hello. Hello, everyone. I'm Yvonne Malloy. I'm the Chief Operating Officer and the Vice President of Special Projects and Programs here at NHMA, and I'm very happy to have you all join us. Thank you.
Okay. Is there anyone that has not introduced themselves? Okay, great, fantastic. What a great group of people. Thank you so much for your time and taking the time to spend this session with us. And so with that, let's move on to the next slide.
So sorry, really quick. My name is Madeline Garcia. I'm not really sure I should be in this meeting. I'm a medical student at Keck, and it really seems that I'm out of my depth, but I was sent the invitation to this meeting and it seemed really interesting, but it kind of seems like this is more of a planning meeting for some leaders and
No,
people on the
you are
board.
welcome. If you are planning to be a future leader, this is a place for you to learn.
Okay, okay, then I'll just
Okay.
listen in. Thank you.
Welcome, welcome, welcome. And I'm sorry I didn't catch your name.
And
Oh, Madeline.
Madeline, you're already a leader.
Uh-huh. There you go.
Thank you. I
I
appreciate
see
that.
a new name, Rodriguez Jr. Would you like to introduce yourself?
Dr. Rodriguez from the Department of Neurology. Yeah, it's excited to hear what is going to be presented. And I think all of our medical students, undergraduate students should all remember that they're our future. So welcome, Madeline.
Great. Please, if there's anyone that I left out, please introduce yourself. And again, welcome to everyone. For those who do not know about the National Hispanic Medical Association, just want to do a quick intro. It was established in 1994, Washington, D.C. It is a 501c6 nonpartisan nonprofit membership association representing the interests of over 57,000 licensed Hispanic physicians in the United States. Our vision is to create a just and innovative healthcare system that's influenced by Hispanic and Latino leaders, where equity is the standard, collaboration drives excellence, communities thrive, and medicine reflects the voices, knowledge, and the brilliance of all the people it serves. NHA wants to help to lead the transformation of healthcare by empowering Hispanic and Latino physicians and the communities as architects of equity and innovation. We want to amplify the voices so that we can reshape policy, advance sustainable, just access to care, and cultivate a thriving, inclusive healthcare workforce. It fosters a network that promotes mentorship, professional growth, and leadership among Hispanic and Latino physicians while strengthening diversity and collaboration to build a united, impactful healthcare community. Next slide, please. With that, I'd like to introduce our wonderful moderator, Jonathan Cohen, who will take it on from here.
Thank you. Thank you very much, Dr. Torres Burgos. So I have the pleasure of introducing our panelists for today. We've all introduced ourselves briefly. So again, I'm Jonathan Cohen, and I'm here because I have the immense privilege of representing the Keck School of Medicine in Washington, D.C. on USC's new Capitol campus. And as part of that, working closely with NHMA on this exciting new partnership, which we're all going to talk a bit about. So in addition to hearing from me, you're going to be hearing from Dr. Torres Burgos, who is well known to many of you. She is, of course, a specialist in preventive medicine and public health and pediatrics. Dr. Torres Burgos currently leads the Advancing Physician Leaders Fellowship at NHMA. There is so much that I could say about her professional experience and qualifications. What I want to emphasize is how dedicated she is to mentoring others. She is herself a proud graduate of the NHMA Leadership Fellowship, which is the topic of our webinar today. She has served as co-chair of NHMA national chapters and as chair of the NHMA New York chapter, which is where she's based. And has many years of experience in leadership training programs for underrepresented minority academic physicians and health professionals. So we're thrilled to have Diana Torres Burgos on our panel today. And then we will also be hearing from Dr. Linda Mirdamati, who of course is also very well known to many of you and has too many qualifications and experiences and accolades to mention in this short introduction. But let me just emphasize again that She is an internist. She's a former partner with the Southern California Permanente Medical Group. She is the former chief wellness officer and medical director for the Center for Healthy Living and Weight Management. She's an adjunct assistant clinical professor at USC, where she teaches Introduction to Clinical Medicine. She's, of course, on the board of NHMA, where she co-chairs the National Policy and Advocacy Committee, and is a former NHMA and NHHF, National Hispanic Health Foundation Leadership Fellow, and is a tireless advocate for health equity at the local, state, and national levels. So you'll be hearing from each of us about different aspects of the partnership between USC and NHMA, as well as the Advancing Physician Leaders Fellowship, the APLF, and then we'll have time for discussion. So let's go to the next slide. Okay, so a lot of this, what we're going to talk about today, at least the USC partnership with NHMA, really began when the University of Southern California established a capital campus in Washington, D.C., which is where I'm calling in from today. This is an image of the USC Capitol campus, which was established just a few years ago in the heart of downtown Washington in DuPont Circle. And the opening of this campus really created an opportunity for us at USC to deepen our relationships with our Washington, D.C. based partners, who also have roots in Southern California. And NHMA is a perfect example of that. An organization with a long history and legacy, and a proud membership in Southern California, many of whom are here today, as well as a headquarters and a deep policy footprint in Washington, D.C., which makes them an ideal partner for us at USC. Shortly after we established the campus, the dean of our medical school, Carolyn Meltzer, had the vision to set up a federal program for the Keck School of Medicine in D.C., and we began conversations with NHMA, principally Dr. Mir Damati, as well as the leadership, Dr. Torres Burgos, Dr. Gil Burgos, the then CEO, about how the Keck School of Medicine and USC could work together with NHMA on developing physician leaders, on strengthening pathway programs, and on advocating for shared policy priorities. And throughout 2024 and 25, as USC's medical school's representative in DC, I had the distinct opportunity to participate in a number of NHMA programs in Washington. So, for example, we brought 2 students with the Latino Medical Students Association to Washington, D.C. for a conference and advocacy day. I had the opportunity to speak to Hispanic Leadership Development Fellowships sponsored by NHMA. I was able to attend the NHMA National Conference that Dr. Preciado referenced in Anaheim, which was an extraordinary opportunity to speak about the importance of advocacy on a panel that Dr. Mir Damati organized. We hosted the leadership of NHMA at the USC Capitol campus at this building, with the California Surgeon General, Dr. Diana Ramos, to begin talking about a partnership agreement. And all of this culminated in a formal partnership agreement between USC's Keck School of Medicine and Institute on Inequalities in Global Health and NHMA, in which we declared our joint intention to work together on a number of activities. Let's go to the next slide. And we launched this partnership agreement last fall at a really exciting event on the occasion of National Latino Physician Day. And here are just a few photographs of that event. You can see on the left a panel involving the key signatories to the partnership agreement. There's Dean Carolyn Meltzer of the Keck School of Medicine, Dr. Gil Burgos, Professor Sophia Gruskin of the Institute on Inequalities in Global Health at USC, and Dr. Mir Damati, discussing the importance of this partnership agreement, which is a real landmark for us. Next to that, you see Dr. Mir Damati moderating a panel of students. So, of course, if there were ever any doubt about whether students belong in this partnership, let me lay that to rest. We could not even dream of having a leadership development partnership without involving our students, and that was reflected in the launch. And that brings us to the implementation of this exciting partnership agreement. And one of the first priorities for our implementation is the APLF, the Advancing Physician Leaders Program, which is a prestigious, decades-long program that you're going to hear all about. And before I turn it over to Dr. Torres Burgos, I just want to underscore again how honored we at USC are to be the academic partner on this program. We know that this program has flourished in the past because of its academic partnerships, because it has benefited from a strong cohort of academic faculty who can mentor fellows, who can advise the program, who can contribute to curriculum development, who can help contribute and raise funds for the program. That is the strength of a university. That's the strength of USC. And we really are so very honored to be part of it. And we just wanted to take this opportunity today to share a little bit about our plans and catch up our USC and Southern California community about that. And you will, of course, be hearing a call to action at the end about how you can help. So with that, I have the pleasure of turning it over to Dr. Diana Torres Burgos to share more about APLF. Thank you. Over to you, Diana.
So I'm just going to give an overview of the program. And basically, the Leadership Fellowship is really all about cultivating future healthcare leaders. And it started in 1999 to empower Hispanic physicians and those who care for Hispanic communities to become influential leaders and advocates across different health sectors in health policy, implementation, and program development. It's designed to help physicians enhance their leadership skills, increase their presence in executive roles within government, academia, institutions, or healthcare organizations. And when we talk about various sectors, we really are talking federal, state, local, because we are needed everywhere. By providing participants with these skills, valuable resources, and impactful network opportunities, we hope to foster transformative leaders who are dedicated to driving meaningful change and creating a healthier, more equitable future for all communities. And I need not say that right now, physician leadership in shaping healthcare policy, advocacy, and equity is more critical than ever. And so that's why it's very important to have programs like this. Excuse me, next slide. So the program briefly is a 12-month learning experience program designed for early and mid-career physicians. When we talk early, usually 3 years out of residency, the core topics are leadership development, where we strengthen their leadership. We have them do self-assessments. We also teach advocacy and policy skill sets, and we have them directly engage with national leaders. We also do policymaking and advocacy where they actively participate in policymaking process through a comprehensive program that strengthens their ability to advocate for health equity, culminating in a capstone policy brief project. This is where they get together as teams and they do research on a relevant topic for Latinos, for Latino health, and then they will take that, develop it, create it, and present it to legislators at all levels. Also, the big thing is networking, that we're building a powerful professional network through these events and to really build the social capital of people to be able to work and collaborate together. CME is provided for all those that do participate within that. Next slide, please. And the key components are orientation happens at the annual conference. And then thereafter, there are 8 virtual learning sessions. There are 2-hour sessions held over 3 months where various topics relevant to all the core competencies are done. Also, networking with people who are seasoned Latino leaders and learning how they were able to get through their journeys and how they dealt with challenges and things like that. The next thing is we have a 1-week session in Washington, D.C., where again we have in-session topics like conflict management and negotiation, financing. We actually do invite think tanks from both all sides to come and talk on how they do advocacy. and also learn effective strategies on meeting legislators and things like that. We actually had this last year congressional briefing, and we did multiple legislative visits with senators and House representatives promoting what our Latino health priorities were for that year. So you're actually having the experience of talking to government officials. Again, there's a capstone project where they work as teams to develop a policy brief on a priority health issue. And you're not only developing it, but you're also going to use it and present it with legislative members. They will also present at the end of the year their policy brief at the national conference. But what really sets apart this fellowship, that uniqueness, is that it not only covers the mainstream and what we call traditional leadership topics, but it actually addresses the specific challenges faced by Latinos, providing opportunities to learn and receive support from experienced leaders. There are a lot of leadership programs out there. There are very few that are tailored to Latinos. So that's one thing that I really wanted to get across. Next, please. Participant eligibility needs to be a U.S. licensed physician with at least 3 years post-training, be interested in becoming a transformative healthcare leader, have some experience with leadership within their community or institution, are interested in public health and health policy at any level, federal, state, or local. They're committed to improving health outcomes within Latino community through advocacy and collaboration. And must be a member of NHMA or willing to become a member of NHMA. Next, please. So just to share some accomplishments, it started in 1999 and up to 2025, we've had 200 physician fellows complete the fellowship program. We recently sent out a survey in February in 2025, a response rate of 25%. Of those who did respond, 80% were currently in leadership roles. And as you can see here in different sectors, 30% at universities, 19% in hospitals, 10% in government, outpatient clinics, 19%, 5% in private practice, 3% in nonprofit, corporate industry also 3%, HMOs 2%, and consultants 2%. 84% of those who responded are working with Latino communities directly, and 89% strongly agreed or somewhat agreed that the fellowship helped identify their leadership style, maximize their career advancement, and personal development. There are a lot of leadership opportunities both internally to NHMA and externally. A lot of fellows go on to become NHMA chapter chairs, board members. They lead projects, become part of grants, lead communities and community events. Also, they become representatives to local and national events of NHMA. NHMA also does endorse nominations for government and healthcare organization position requests, because we as NHMA are constantly getting requests, do you have anybody who come talk to us about this or can join this advisory committee or things like that. For people that are really interested, there are opportunities, and NHMA will help you connect to those opportunities. Next slide, please. So some of the success stories, and these are just very few, but wanted to point out that Dr. Oxidi Barbeau and Dr. Jaime Torres were part of the initial cohorts. And Oxidi Barbeau is a former New York City Health Commissioner of New York City, who is now President and CEO of the United Hospital Fund. Jaime Torres is now the president of Latinos for Healthcare Equity, a foundation he founded, and also advisor to Urban Health, which was one of the largest FQHCs within New York City. But he was the former Region 2 director for the U.S. Health and Human Services appointed by Obama to lead Region 2, which includes New York, New Jersey, Connecticut, and Puerto Rico and the Virgin Islands. And of course, we have Dr. Linda Rindamadi, who, again, she will tell you more about her experiences and share them. And then Our most recent fellow last year, Dr. Gardner, Roka Gardner, she is now has become the chair of her ID department at her hospital, Emory University Hospital, Midtown. And she is already become involved in a lot of our projects. And here you see a quote from her: as an immigrant Latina physician, now in a leadership position in my hospital, NHMA has given me the tools to succeed and grow in my career. We as a people cannot be erased. So this is just a little taste of all the voices that we have. And with that, if there are any questions, okay. I'd like to talk about the future goals in terms of our partnership and the goals for the leadership program. And that is, we want to grow with USC as an academic partner and build healthcare physician leaders in a pipeline of physicians that represent our diverse communities. We want to continue to increase the number of Latino physicians to represent the communities they serve, also to have them become decision makers within their communities and institutions. Integration of emerging healthcare. We are hoping to keep the curriculum also current. So adding things such as, AI in health, as all of you have heard, has become an issue. Strategic collaboration, telehealth and remote healthcare, which has become used more now than ever. The issue of physician shortages and technology, and how are we going to be able to still have services, for our communities. Create sustainable funding is a very big goal. We have not had cohorts for every year. Funding is always an issue, so that is very important to us. We want to expand plans, reach broader, more fellows and newer subspecialties. We do plan at our annual conference in May to do a kickoff for the NHMA Alumni Leadership Fellows Network, and we really want to use this to strengthen alum networking and mentorship and the ability to collaborate across all specialties and across the U.S. Next. And with that, I'm so excited and happy to introduce Dr. Linda Mindamati, who was a recent fellow who would share her experiences with you. I think we're going to leave the questions till the end.
Yeah, so I think what we're going to do is we'll hear from Dr. Mirdamati, then we're going to come back to you, Diana, for a call to action, and then we'll have questions and discussion.
Sounds great. Thank you.
Yeah.
You're on, Linda.
Wonderful. Thank you. Thank you, everyone. Welcome again. I'm really so excited to see so many of my own colleagues that I know so many on a personal basis that joined us today. So this really means a lot to me because these are two organizations, USC, the Keck School of Medicine, IIGH, and now NHMA, that we get to develop this partnership. To have you on board with us is really very special. So thank you, Dr. Torres Burgos, for laying out the framework and some of the successes and the goals of the program. And what I wanted to do today was really share with all of you that joined us today, is it more of a personal basis? Like, what did this fellowship mean to me? What did I get out of it? And I will have to say, it was truly the highlight of my career, absolute highlight. This fellowship was something that I took very seriously. I was honored to be named one of 12 fellows across the US. It's a very competitive pool of physicians, and to be involved in this group of 12 was amazing. And to spend an entire year with very passionate leaders that come from their community, that already want to give back, that want to learn how to really influence and shape policy. And in a leadership role, I think was really a special. One thing that we did that even made it, I think, more intimate out of the 12 is that we were broken into groups of about 3 to 4 of us per group. And then we chose as a group an issue. So we identified an issue that we were passionate about, that we wanted to help write a briefing on, recommendations on, something that we could dive into some research. And my group, at that time, we decided to focus on mental health. And we focused on mental health for a couple of reasons. Number one, it disproportionately affects our young adolescents and teens, especially our Latino population. And with the coupled effects of decreased access to healthcare and with cuts in mental health services, we felt it was really extremely important to help develop some recommendations on a national level. And so I worked together doing that. We dove into research. We met with legislators. We met with agencies, both at the state and at the federal level. And we were able to then develop some recommendations that we felt was really pertinent to serving not only our Latino population, but really all under-resourced and underserved populations throughout the US. We were honored then to present our recommendations at our 27th annual NHMA conference. And that was really a fantastic opportunity for us to showcase the work that we did. Every cohort got to do that. So again, there were 12 of us. They were broken up into 3 to 4 people, 3 to 4 groups, and then each group assigned a representative to present at the conference. And the conference, we had 400 people from all over the nation. The conference was held in Washington, D.C. We had some legislators there. We had academic leaders there. We had people in advocacy and policy. It was really a wonderful opportunity to display and to showcase some of the work that we had done. As a result of that, during the DC week, as Dr. Torres Burgos mentioned, that we all go to spend the entire week in DC, we were invited, our 12 fellows at the time for this class in 2023, we were invited to the White House, and we actually met with senior advisors and the special assistants to the Biden-Harris administration. And we sat in a room, intimate gathering. There probably wasn't more than 20 of us. And literally, each of the groups, we got to present our findings and present our recommendations and have a very deep discussion with these special assistants and senior advisors that were working with the administration. Their roles in the administration at the time were overseeing mental health, veterans affairs, homelessness. It was really very important to share our recommendations with them. And as a result of that, relationships are made, networks are created. As Dr. Torres Burgos was relating to, that is what is the most important thing to do. I will have to tell you, at the end of my presentation, when we were there at the White House, one of the senior advisors, Terry, picked up on the fact that I was from USC. And here we are sitting at the White House in a big table, big boardroom table, and she flashes me a fight on right above the table. And she says to me, I overheard you say that you're from USC. She goes, I'm a Trojan mom. I'm a parent. My son just graduated from USC. Well, that's all it took, right? You know, the USC network. We connected on LinkedIn, and we have still stayed in contact to this day, which is fantastic. Of course, she's no longer in the current administration. With the transition transition of the current administration, she moved on. But the point being said, it was an incredible opportunity to really work and expand our network on behalf of NHMA. While we were there, we also were invited to the HHS, the Health and Human Services Agency. We were there actually for the launch of the ARPA-H event and that programming, and we got to meet with Javier Becerra, had an amazing time with him, met with his deputies as well. We met with Senator Alex Padilla, who's from California, U.S. Senator, and had, again, conversations with him about mental health and equity and equitable access to healthcare. So we've got some really good friends up on Capitol Hill that NHMA has really forged relationships with. While we were there, we also attended a congressional hearing. It was the hearing, it was the HELP hearing. It was the Health, Education, Labor, and Pension committee that was being chaired at that time by Senator Elizabeth Warren. So we all attended that. That was my first time ever attending a hearing up on Capitol Hill. And the subject of that hearing was childcare subsidies, women in the workforce. It was really very pertinent for many of us women leaders that were sitting in the room, I'd have to say. And of course, that was another opportunity of connecting a network after the committee hearing was over. She knew that we were there from NHMA. And after the committee hearing was over, we all walked up to the bench. She walked out around the bench and to the floor. We had a moment to speak with her. We talked about our policy recommendations. We talked about NHMA and about the work that we're doing back at our local state. It was a big photo op opportunity, but more importantly than anything, it was an opportunity to meet our leaders that are up on Capitol Hill, that we really have to leverage these relationships as we move forward and advocating for equity-centered health policy. During our week there, we also had the opportunity to go on field trips, I like to say. We met with key stakeholders, leaders at multiple federal agencies. We were at the Office of Minority Health. We spent another afternoon at the CBO. You guys hear about the CBO all the time on the news. That's a Congressional Budget Office. They're the ones that do all the finance analysis and research when a bill is working its way through Congress. Everybody wants to know, right? How much is this going to cost? Right? Do we have the funds to support this? And so the CBO does all of that research. And so sitting in a conference room with the key leaders in CBO and learning about how that organization works and how they do their work was, I think, really vital and critical to us then. We also went to the CDC and we visited many other federal agencies. But I found it was very, very helpful, and it made a huge impact on my life and on my career. And go ahead and advance to the next slide, please. And it truly, truly made a life-changing impact. Even though the work that I did was all focused at the federal level, when I left that fellowship and I came back to the state of California, where I'm in LA with all of you, it really lit and inspired me and put like the fire in my belly to get involved. And I wanted to get involved at the local and at the state level because I wanted to be able to make that connection from local, state to federal. And I did do the NHHF fellowship actually at the same time, which was really nice. So I did learn the California policy at the same time in tandem of national. But what I wanted to mention is that after finishing the fellowship, it really gave me an opportunity. It gave me the experience, it gave me the knowledge, the networking, the ability to communicate with your legislators. But it gave me this opportunity to be able to pursue further leadership roles at the county, state, and federal level. And I listed a couple of those. One is I was since elected to the LA County Medical Association Board of Directors, and I currently serve on our Legislative Action Committee. And the work that we do is local. So we work at the county level. We also work in partnership with CMA, which is the California Medical Association. But a lot of the work that we do is local, working with our Board of Supervisors. We have a very good relationship with them. I also work a lot throughout the state with many of our state legislators, close relationships with our California senator and assembly persons. So that's been an incredible opportunity to work with LACMA. I also most recently was appointed by the CMA, the California Medical Association Board of Trustees, to the California delegation to the AMA House of Delegates. The American Medical Association House of Delegates is the policymaking arm of the AMA. And it's through that House of Delegates where we develop resolutions and influence and shape federal policy. And so that has been an honor to work at the county and state and federal level. And then, of course, last but not least, is I currently serve on the NHMA Board of Directors, and I am so honored that I currently chair our National Policy and Advocacy Committee. So I work very, very closely with our team in Washington, D.C., and I help develop all the strategies and the priorities moving forward with the policies that NHMA wants to support through, whether it's advocating, lobbying on Capitol Hill, whether it's writing letters of support, various avenues, developing briefings, etc. So it has been a great opportunity. I would love for all of you who are interested to join our academic partnership with USC. It's been great working with Jonathan Cohen. He's been my fabulous partner, Dr. Burkholder with IIGH as well. So I really want to emphasize how important it is that this partnership continues to develop, evolve, but we can't do it alone, and we really need your help. So I'm going to go ahead and pass it on to our call to action and for Q&A. So thank you.
Thank you, Linda. And back to you, Diana.
Thank you, Linda. As a former fellow also, I just want to add, I did it many more years ago. And to me, it was a change in my life too. And I've gone on to do things that was never on my bucket list. And it convinced me that, you know what, you can be a leader. And sometimes you just need someone to give you that little push. And that's what the fellowship did for me. And so I am always very grateful because it led me to places that I never envisioned, but I thought were very, very important and impactful for communities and, my patients. So you're probably all wondering why we're having you here. And part of it is we have a call to action. As Linda mentioned very clearly, we cannot do this alone. So we are inviting you to join us in developing physician leaders to create lasting change in healthcare and promote equity. And there are opportunities for you to be able to help us with that. And that includes things like advisory group, being a member of the advisory group of the Leadership Fellowship. You are all experts in your fields. We need expertise and speakers for, the fellowship. We also need mentors. Mentorship is very, very important in helping to build the pipeline and to help people progress through their careers. You also may know of people that you want to nominate for the fellowship. That you think that they are really ready to be a fellow and to be a leader, and they just need that push. They just need that place to go. There was a faculty survey that was sent out with the invitation, so if people can fill that out, that'll give us more of an idea of opportunities that you can help us with. And more importantly, if you're interested and you think this is very important, you can help to sponsor the fellowship. Or if you know potential sponsors who are really interested in increasing Latino physician leaders in the pipeline of Latino physicians, we invite you to really connect us with them, and we'll outreach with them, because one thing we want to do is we want to make this a sustainable program. And as you know, funding is always an issue regarding that. So with that, I want to thank you for your time and for listening. And I think we're going to open it up to questions at this point.
Great, thank you. So we have a little over 5 minutes for questions and comments. Maybe, Viviana, I could ask you to stop sharing the slides and then turn them back on for the final announcements, just so we can all see each other. And if you have a question, probably easiest would be for you to turn on your camera and use the raise hand function. And if not, if I don't see any raised hands, I'll just invite folks to jump in. Yes, Michelle.
Hi, thank you so much. I'm in my office, so just put on the camera. So I was lucky to participate when National Hispanic Health Foundation and NHMA were doing the leadership program together. One of the things that I think is something that we should all look into is having projects that continue past the 1 year mark. So once we do the research, for example, at the time when I and our group worked on, we were looking at creating a modifier for us as clinicians to use if we use another language. So Spanish was our basic focus, but using a modifier so that we can get compensated for the additional time that we spend, and so that language can be kind of recognized as a skill. Once we kind of finished the fellowship, though, that kind of was difficult to continue the momentum. And so I'm wondering, what are the thoughts in the fellowship going forward? Are there going to be programs where we're going to continue and allow for that? Because I think that that would be a great addition to the fellowship in general.
I think that is a great question and part of why we are building the alumni network, because we do want to continue with some of these projects. For instance, one of our fellows from our last year did a whole language access policy brief. This is where it's important to connect, saying, how can we move this forward? So I think that's a great question that you have. And we will be doing a kickoff. We will have a session, I don't know at what day or how long right now, where we want alums to meet, to connect, to be able to collaborate, create, connect, all those wonderful C words. I can't think of any more. Maybe you guys can. But the important thing is that is really what is very, very important, is that whether you're here or there, you're California, you're in New York, you're in Midwest, Southwest, you need to connect because we all have the same drive, the same goal, the same vision, but it may look differently depending on where you come from. And then are there people that are within your area that want to work actually locally as opposed to on the national level or the state level? So those are all things by having a network where you can actually, strengthen each other's advocacy, collaboration. You can collaborate on grants together. So I think there are a lot of opportunities there, and also celebrate. We need to celebrate. We don't do that enough. We don't pat ourselves on the back. We don't nominate people enough who are skilled, who have the skill sets to be able to do certain things, and nominate them for those, for those awards. We don't do that enough. And that's what I hope this alumni network will be able to do. So I really love that question, because that is really what we're trying to promote.
Right. I was going to just mention something. Can you hear me?
Yeah.
In my opinion, the most important thing that we could do with the USC, working with the National Hispanic Medical Association, is mentorship. And this is what I mean. What I mean is we're still not getting enough students into our own schools. USC, UCLA, we haven't done the best job at trying to mentor students to get into these schools. And having mentored over 10, I've had about 10 mentees where I have taken them by the hand, not babysat them, but I've taken them by the hand, taught them, figured out what postbac they could get into, figure out what they need to do to get in. Because a lot of times we talk in these big meetings about mentorship, but we really need all of you doctors, especially on the call, to take a couple of students and mentor them, make them the key connections so they get into medical school. And number two, what I really need as a board member of the National Hispanic Medical Association, I want everyone who's on this call, number one, to become a member of the National Hispanic Medical Association. We need your support. There's a lot of issues right now with getting funding and grants that haven't been, that they're not giving us. And I think all of you, I called you personally because I know you're talented. You're all so talented, and we get very busy. But if we want to increase the number of Hispanic doctors, we're going to have to do the work. That's all I have to say. But I have to go. But thank you guys so much for inviting me.
Thank you. Sylvia, connect with me. I'm going to connect you to my Latino student in medicine group that are undergrad students at USC. So I need all of you to help me mentor those kids. I'd love that. Thank you. Thank you for joining us. I also...
inclusive. Everyone needs to do
absolutely.
This.
Absolutely. And I also want to circle back to Dr. Cabrera, if you're still on the call. and this is really pertinent for everybody. I would really love to encourage all of you to get involved with our local medical associations. So LACMA, we have, as I mentioned, I serve on our Legislative Action Committee. So what I've been able to do is I've taken my passion for mental health access, and when Proposition 1, the MCO tax for the state of California, was coming on the ballot, I was working closely with our team, our legislative team, working closely up on Capitol Hill, working closely with our governor to ensure that the language was in that MCO tax that was going to ensure that there was monies that was going to be carved out to improve access to mental health care and to expand Medicaid, which is Medi-Cal in California. So there is a way that you can, Dr. Cabrera, if you're passionate about a certain issue, is to get involved. So with LACMA and CMA, I would definitely ask you, contact me. Let's get involved, get you involved, and we could still pick up on all those areas, policy issues that you're passionate about. So we can spearhead these equity-centered policy initiatives. So thank you. Any other questions before we go? I think we're at 12:59.
Any other questions? So I think what we can do is, again, there are opportunities for a lot of collaboration and questions. And if you don't have anyone, if I can get the next slides, please.
Yeah, let's put the slides back up. We have some final reminders. Yeah.
So she mentioned about becoming a member. Again, that would help support all this. And there's a QR code here. If you want to join at this time, you can just scan it right now. And it's really joining a community of healthcare professionals that are really interested in advocacy, improving health outcomes for our communities, and developing leaders from our communities. So I think it's very, very important. The other thing is, next slide, please. Again, this is also another way you can join NHMA today. Next slide, please, last. One thing I would like everyone to know is we have our annual conference this year in on May 27th through the 29th. And it's actually, the title is Medicina con Propósito, Empowering with Education, Advocacy, and Leadership. So we really invite you all to come and meet with us in person and share activities with us. We will be doing Congress visits, so we will have that opportunity while we're there, but also get to meet friends. I've always loved going just to recharge and come back and say, yes, we can do what we want to do. So I think that's very, very important. And lastly, if there are any questions or any point you want to talk with us, here are emails, my email, Viviana's email, and Vincent Giardi's email for strategic partnerships. Please feel free to reach out to us at any time, and I'll be happy to discuss any questions that you have, and any ideas. We welcome ideas because, again, diversity is the name of the game. We could come up with better ideas together than we can alone. And so I think I really, really do look forward to getting feedback from everybody. And I want to thank you again for taking the time to spend this hour with us. Appreciate your coming to this session. And I hope to see and hear from you in the future. And I'll leave the last words to Jonathan.
Well, thank you all very much. We will follow up with you. I'm sure that this conversation has sparked questions and ideas. This is just the beginning, and we'll be in touch. And thank you so much for your dedication, and thanks to the amazing team, especially Viviana, and also Vita and Yvonne, who worked so hard to put this hour together. We're really excited about this partnership and to continuing this conversation with all of you. Enjoy the rest of your day.
Thank you, everyone. Thanks for joining.
Thank you, everyone. Have a
Thank
great
you.
day.
Take care, everybody.
All
Right on.
Bye-bye.